Hi, I'm Dr. Rich. In this video, I'm going to show you how I use the Dr. Murph Crane Pick. Now, this isn't a sponsored video. I actually bought the user's guide and a couple crane picks direct from Dr. Murph off of eBay. I'm going to leave a link to that listing down below in the description. And also, if you don't want to get the book, although I highly recommend it, you can also just buy the crane pick itself from either eBay from Dr. Murph, or you can also order it from American Dental Accessories out of Minneapolis. I think it's Minneapolis, Minnesota. I'll leave a link to that as well. Again, not a sponsored video. I'm making this video just to show how I use this, because I've used this in a few of my extraction videos to give people an idea how to use it. Is it the perfect instrument to take out every single tooth? No, but you can use it for certain situations and it works really, really well. It's always a good tool to have. Another tool to have in the toolbox when you're pulling teeth. Sometimes you just need that right instrument to remove a pesky tooth. And if you want a refresher course on removing teeth, I also highly recommend the Dr. Murph Extraction Guide for the Exodontist. I've had this for quite a while. It's copyright 2010. So again, not a sponsored video, just a fan of Dr. Murph. I consider him a friend. He's always helpful anytime I've had any questions over the years. All right, so let's go in to first how you hold it. What you want to do, it's got two little indentations. You want to put your middle finger in one, thumb in the other. Take your index finger and put it on the shaft of the instrument, and now you're ready to pull a tooth.
But first, let me demonstrate how to use it on a model. So just so you get the general principle of it. So you're holding it, and you're going to use this to remove the very last tooth on the upper arch. You just push it in between in those teeth, push the tip down in there, and then just twist the instrument. And that'll wedge the Dr. Murph Crane Pick in between the tooth and the jawbone and push the tooth kind of backwards, distally, and towards the cheek. So now let's do it on a couple cases. So the first case I have is an upper left wisdom tooth. There's the x-ray. You can see it's pretty abscessed. So we just take the crane pick, press it up in there, press it deep, and twist. And this tooth was an easy one that showcases it very well because there was not much bone holding this wisdom tooth in. So I got it loose and up, and then it was still attached by the gingiva, so I got to remove it with a pair of forceps. And here's our next case. It's a upper second molar. There you can see the Panorex, and this one, what I find sometimes is I have trouble getting enough space to get the Dr. Murph Crane Pick in. So I'll start first with a spade proximator and then a 301 and try to get the tooth moving a little bit, give myself a little bit more room for the Dr. Murph Crane Pick, and then I use that. And again, same type of technique, stick it in and twist, and there you have the tooth coming out. This tooth was a little bit of a bear to remove because if you look close at the root tips, you could see they're kind of hooked, but we did get it out in one piece. All right, here's the final case I'm going to show you. This is a lower wisdom tooth. So it's tooth number 17, lower left wisdom tooth. There you can see on the close-up of the pano. It's partially up, but it's stuck on the tooth in front. Luckily, the roots aren't fully developed yet, but this is one of those situations, though, where don't have enough space. So I'll first start using a spade proximator, then a straight luxator to get the tooth moving and to give me a little bit more space. So in addition to working it in the mesial, I'll also work it on the buccal right there in the furcation area just to get some more movement out of the tooth, try to get the tooth moving backwards. Now I'm going on to the 301 elevator, again, just to give me some more space. You can see it moving, and again, more on the mesial. Now I've got a decent amount of movement, so now I can use the Dr. Murph Crane Pick, and it's just basically the upside down version of doing it on top, and then get it in there, twist, and rotate it up, and you see it's popping up out of the socket, and it's pretty loose now. So now I'm just going to grab it with my forceps and take it out of the mouth. So I hope you guys found this video interesting of how to use the Dr. Murph Crane Pick. It's a wonderful tool to have. I enjoy using it on my cases. So thank you guys all so much for watching. Any questions or comments, please leave them below, and we'll see you in the next video.